Brother, be honest with me for 60 seconds. One unprotected night or one shared needle can write months of silence into your body before any clue appears. I'm Dr. James, a urologist and physician scientist for 20 years, and I've seen how quiet infections steal time, energy, and confidence from good men. The 2025 CDC picture is sobering. About 80% of new male infections link back to unprotected sex and needle sharing, risks we can reduce with smart habits. Here is what you will get today: the 5 highest risk transmission routes for men, 3 science-driven prevention moves you can start this week, and 1 little-known clinical tactic. That tactic helps you stay ahead of early symptoms, fortify your immune system, and keep your head clear even if your partner is living with HIV. If this conversation matters to you, hit subscribe and comment 9 so we continue together. Your click helps me reach the first 1,000 and carry facts further. It is a tiny action for you, but for me, it is proof that you trust this mission and want your brothers to hear it too. Stay to the end, because I'll hand you a bonus tip to move ahead of symptoms, build resilience, and support performance and comfort in the bedroom. Prevention is not fear. Prevention is control and communication, and I will show you how to practice it tonight. Breathe in, focus, and follow me so you leave with clarity, tools, and confidence you can use right away. To protect yourself, you must first understand how the virus finds a door into a man's body. A journey that is short, quiet, and efficient when we don't pay attention. Next, I'll walk you through the transmission mechanics in men: skin microtears, urethral exposure, rectal lining fragility, and blood contact. So prevention becomes simple, automatic, and something you can practice tonight, safely. Before we start, quick question. Which route do you think is the most dangerous right now in the US? Drop your guess in the comments and I will wait for it there while we walk through the facts so your answer lands with confidence. 1. Vaginal intercourse without protection. HIV can enter through the urethra at the tip of the penis, through tiny abrasions on the glands or inner foreskin, and through inflamed skin you may not even notice. Even when you feel completely fine, a small patch of irritation is a door left open, especially after friction, shaving, or a recent untreated STI. Case snapshot. Jack, 27. He came in for a painless tiny bump he assumed was allergy or friction. Routine screening caught an early HIV infection, and he started treatment immediately with a plan for his partner's safety. Action for you. If you have had a similar moment, comment 1, and I will reply with a simple at-home checklist and the right timeline for testing. Now let's move to the second route, the one growing most rapidly in many U.S. cities. 2. Anal sex, receptive or insertive, without protection. Per act risk is the highest here because the rectal lining is thin, easily torn, and rich with the very immune cells HIV targets. Many men think they are safe if they are the active partner, but microscopic tears and urethral exposure still create a path. Mini hook. One unprotected encounter can carry a much higher risk than vaginal sex, sometimes an order of magnitude higher in studies. I know that sounds hard to believe, but it is exactly why awareness and technique matter as much as desire and consent. If you want a clear, judgment-free guide on how to protect this area the right way, comment 2. If there is a detail I did not cover, ask it plainly, and I will add what you need in the thread. Bridge to the next route. We have talked about sexual routes. Now let's talk about direct blood exposure, the path that moves fastest. 3. Blood and needles. Intravenous transmission. Sharing needles is the quickest way to move infected blood from one body to another, because a tiny volume trapped in a used syringe is enough. This includes reusing cookers, cottons, rinse water, or bottle caps during drug preparation, where small blood remnants can travel into the vein. Picture the sequence. A trace of blood enters the barrel at the start of an injection, stays there, and then meets the next person's bloodstream unfiltered. That is all the virus needs, and it is why single-use equipment and needle exchange programs save lives every single day. If you or a friend has ever injected, comment "safe," and I will post a sterile practice checklist and where to find reputable exchanges and pharmacies. Do not hold back. Questions are how men protect one another, and I would rather answer now than see you in crisis later. Quick tip: condoms with water-based lubricant reduce friction, protect the urethra, and lower microtears that invite the virus in. For anal sex, prevention is technique, condom from start to finish, plenty of lube, and avoid oil-based products that weaken latex. Also remember, accidental blood exposure also occurs with unsterile tattoo tools or needle sticks. If it just happened, seek PEEP within 72 hours and follow a clinician's testing schedule. With the routes mapped, the mechanics will make sense. How microtears, fluids, and time windows create risk, and how biology lets you shut those doors. Before we go on, thank you for still being here. It tells me you truly care about your health, and that already puts you ahead of most men who click away when the hard truths begin to get real. For the next 90 seconds, I will clear up 3 dangerous myths so you leave sharper, calmer, and a full step ahead. Absorb these now, and you double your early protection toolkit for the moments that actually matter. Myth number 1. No symptoms means no HIV. In real life, many early infections in men are quiet for months, and vague signs look like stress, allergies, or the flu. Silence is common, which is why routine testing beats guesswork every single time. Here is the simple logic. If a virus can multiply before your body raises alarms, you cannot rely on how you feel. You rely on time-based testing, condoms, and prompt treatment if positive, because early treatment slams the door on transmission risk. Myth number 2. My girlfriend is negative, so I am safe. Testing has a window period when the virus is present but not yet detectable. A single negative in a partner today does not guarantee yesterday, last week, or last month were risk-free for you. When in doubt, act like a professional. Use protection right now, get a baseline test, repeat on a schedule, and treat exposures with PEEP within 72 hours. Prevention is a calendar, not a guess, and calendars save futures. Myth number 3. Only gay men get HIV. Recent U.S. snapshots show a substantial share of new diagnoses among heterosexual men, roughly a third in some reports. Risk follows behaviors and biology, not identity. Identity labels, which is why facts must drive our choices. The fix is the same for everyone. Condoms with proper lubricant, routine testing, PrEP for high-risk patterns, and immediate ART if positive. Undetectable means untransmittable, and that truth protects you and the people you care about most. If you have heard any of those myths, comment "seen" and share this clip with one person you respect. Your voice travels farther than mine, and a single share can change the next man's week, choices, and peace of mind. Now that the fog is gone, let's shift into the practical mechanics, where the virus enters, how microtears and fluids create risk, and the exact steps that shut those doors the moment you decide to take control. Deep breath, brother. This part is crucial. Strategy 1 is the double shield. Condom plus lubricant, because friction creates microtears, and microtears are doors a virus can use when your guard is down. Choose FDA-approved latex condoms, check expiration dates, and store them cool, not in a wallet or hot car. Pick the right fit. Snug at the base, comfortable on the shaft. Because too tight breaks, too loose slips, and both defeat protection. Open with fingers, not teeth or keys. When fully erect, pinch the tip to leave a half-inch reservoir. Place on the head and roll to the base. Air at the tip turns pressure into bursts, so the pinch matters every time. Use water-based or silicone-based lubricant on the condom and at entry. Lube lowers friction, preserves latex, and cuts microtears. Avoid oils, lotions, and petroleum, which weaken latex and raise failure risk. Add more lubricant if you feel heat, drag, or sting. Those signals mean friction, not passion. For anal sex, think more lube more often, and reapply. If you change holes or partners, change the condom, because mixing fluids spreads infection. If latex irritates your skin, use polyurethane or polyisoprene. They block viruses and work with lubricants. Never wear 2 condoms at once, because rubber on rubber creates friction and tears. 1 condom, used correctly, protects better than 2 misused. After ejaculation, hold the base and withdraw erect. Slide the condom off and trash it. Comment 1 if you want a step-by-step demo, and stay for strategy 2 next. Here is how ART works in real life. Daily antiretroviral medication drives the virus to extremely low levels, shields your immune cells from ongoing damage, and shifts an active infection into a controlled, quiet background. When viral load becomes undetectable, sexual transmission risk falls to effectively 0. The principle we call U equals U. Undetectable equals untransmittable. Confirmed repeatedly across large modern studies in real-world couples and clinics. Clinically, men who start early and take ART consistently see immune markers rebound, energy and sleep improve, and inflammation cool down because the body can finally stop firefighting and begin real repair. In 2025, summaries and earlier landmark trials, correct treatment cut transmission risk by roughly 96% versus safer sex alone, making timing, adherence, and medical follow-up the heart of prevention. Mini hook, guys. This is why say HIV is not a life sentence for most patients, because with the right routine and support, the virus gets quiet and your life goals come back. But that outcome depends on daily pills, on time visits, routine labs, early side effect management, and not stopping when you feel better, since feeling better happens precisely because the medicine is working. If you want a simple starter plan, comment the word HOPE, and I will share a first-month checklist for meds, labs, pharmacy logistics, reminders, and partner talks that keep both of you protected. Because exposures still happen, our next move is PEP, post-exposure prophylaxis, the urgent 72-hour window where fast action with medication can block the virus before the first big replication wave. PEP is emergency HIV prevention after a possible exposure, and the core idea is simple. Start medication fast so the virus cannot copy itself in your body. The window is within 72 hours, and earlier is always better because the first replication wave happens quickly and quietly. If you think you were exposed, do not wait for symptoms. They are late and unreliable. Go now to an emergency department, urgent care, or a clinic that handles sexual health and say, "I need HIV PEP B." The standard course is 28 days of antiretroviral pills, started immediately after baseline testing for HIV and other STIs. You will also get vaccines or antibiotics if indicated, plus a plan for follow-up labs. Take the medication every day, on time, set alarms, and use a weekly pill box so you don't miss doses. If you notice side effects, tell your clinician early. Tiny adjustments solve most problems and keep protection intact. Use condoms for the full month and until your follow-up testing clears you on schedule. Typical checkpoints are day 0, 6 weeks, and 3 months, with an additional visit if your provider recommends it. If the exposure involved blood or needles, ask about tetanus, hepatitis B vaccination, and hepatitis C testing. If it involved anal sex, remember lubricant and correct condom use prevent the microtears that invite trouble in the first place. This section is only the start. I will reveal a practical, immune support habit that helps you stay ahead even after scares, so keep watching and take notes. When you are ready, we'll move into PrEP, which is how you lower risk before exposure and turn prevention into a steady, confident routine. When it comes to prevention, this is my favorite strategy because it blocks the virus before it even gets a chance to start multiplying. Think of PrEP as a daily firewall that keeps the system clean long before an infection can code itself in. PrEP is a once-daily pill that contains 2 antiretroviral drugs proven to reduce HIV risk. Among men who have sex with men and transgender women, consistent use lowers infection rates by about 44%, and when adherence is perfect, the protection climbs above 90%. That's stronger than seatbelts are for car crashes. The medication works by building a stable level of antiviral compounds inside your bloodstream and tissues. So, if the virus enters, it can't make copies. The drugs stop replication at the earliest stage before integration into your DNA, which is why timing and consistency matter more than dosage size. Who should consider PrEP? Men whose partners are HIV positive, healthcare or social service workers with occupational exposure, and anyone whose sexual life includes inconsistent condom use or multiple partners. It's a responsible, science-based decision, not a moral label. Before starting, get an HIV test and kidney check. After that, testing repeats every 3 months to confirm you remain negative and healthy. Set reminders, link it with brushing your teeth, and treat it like a vitamin that builds long-term confidence. This is the silent armor of our generation. Quiet, steady, and always working in the background. If you want me to share the official 2025 U.S. PrEP protocol, comment ARMOR. And if you know someone who could benefit, share this clip now. Because next, we'll expose the 5 mistakes most men still make, even after learning every prevention rule. Do not stop here, brother. You have already reached a place most men never see before trouble arrives. So take this part seriously. Write it down and keep it handy, because avoiding predictable mistakes is faster than recovering after the damage is done. Mistake 1 is ignoring risk when nothing hurts, because early HIV often feels like stress, allergies, or a passing cold. When your body is quiet, you still schedule tests, use condoms, and treat exposures with PEEP instead of waiting for symptoms that never arrive on time. Mistake 2 is stopping ART the moment you feel strong again. Improvement means the medication is working, not that the virus is gone, so you stay adherent, manage side effects early with your clinician, and protect your partner under the U equals U principle. Mistake 3 is self-medicating or trusting miracle claims online. Treatment is not a guessing game, dosing needs labs and interactions reviewed, and internet shortcuts cost months, money, and relationships, while a real care team saves all 3 with boring, reliable, measurable routines. Mistake 4 is skipping a regular testing calendar. Prevention is a schedule, not a mood. So set recurring reminders for HIV and STI screening, link them to birthdays or seasons, and treat each result as feedback that updates your plan before problems harden. Mistake 5 is hiding the truth from a partner because of shame or stigma. Secrecy multiplies risk and fear, while honest talks create consent, condom use, shared testing, and practical plans that make intimacy safer, calmer, and more connected for both people involved. Quick fix list you can begin tonight. Condoms with proper lubricant. PrEP if your pattern fits. PP within 72 hours after exposures. Early ART with adherence support if positive. And a sleep, nutrition, exercise routine that keeps your immune system responsive and resilient every week. If at least one of these mistakes sounds familiar, comment the number 5 so I know where to help first, and I will reply with a short, specific correction plan you can screenshot, follow, and share with a friend who might need the same clarity. With the traps identified, we will shift into a real case that ties the science to emotions and decisions, so you can see how a man just like you moved from anxiety to control without losing his relationships or goals. Before solutions, meet Jack, 27. One unprotected night, a painless bump he blamed on friction, and months of feeling fine. He delayed testing, stayed silent, and at 6 months, screening confirmed early HIV. We started ART, explained U equals U, set reminders, and included his partner with condoms, lubricant, and honest talks. By month 3, Jack was undetectable. His partner remained negative and chose PrEP. Jack told me, "I was scared for 2 years until my doctor said the truth. HIV can be locked down." If this gives you strength, comment STRONG. Next, we'll build a 5-layer plan. Congratulations for making it here. Now, breathe, relax, and let me hand you a 5-layer protection plan you can copy tonight without stress or judgment. These are small moves, but they stack, and the stack turns fear into control, which is the most important feeling a man can own in his health life. First, schedule HIV and STI testing every 3 to 6 months, link it to payday or the first weekend, and treat the calendar as equipment, not advice, because equipment is what keeps professionals safe and steady. Second, use the double shield every time. Condom plus water-based or silicone-based lubricant. So friction stays low, micro-tears stay closed, and both partners feel protected without losing connection. Comfort, or the momentum of the moment. Third, if you ever test positive, start ART early and stick with it. Undetectable equals untransmittable, meaning your viral load becomes so low that sex stays safe and your future gets bigger, not smaller. Fourth, when risks happen, move fast. PEP within 72 hours after possible exposure, condoms for the full month, follow-up labs on schedule, and honest updates with your partner so teamwork replaces panic and prevention stays humane. Fifth, consider PrEP if your pattern includes inconsistent condoms, multiple partners, or an HIV-positive partner. Perfect adherence pushes protection above 90% and turns anxiety into a quiet, reliable routine you barely notice day to day. Now for the bonus insight I promised. Build your immune foundation. Sleep deep, move most days, eat fiber and colorful plants, lean protein, and hydrate like an athlete on a long trip. Extra secret, because you stayed. Support natural glutathione production with sufficient sleep, whey or cysteine-rich foods, and regular training. While not a cure or replacement for medication, a stronger antioxidant system keeps inflammatory sparks from becoming a wildfire. If you want my full natural routine and the evidence summary, comment the word NEXT, and I will post the complete checklist in the thread so you can save it, follow it, and share it confidently. Remember, none of this replaces professional care. It amplifies it, and when you combine appointments, medication, testing, and these habits, your life gets bigger while the virus stays smaller, quieter, and under your authority. With layers stacked and the secret in hand, we will build one clear checklist to screenshot, repeat weekly, and teach to a friend you trust. Today, we walked 3 journeys: how HIV enters a man's body, how prevention shuts the doors it tries to use, and how you can turn fear into action that protects your health, your partner, and your future with calm, science-driven steps. You learned key transmission routes, the biology of microtears and fluids, and the calendar moves that matter most: condoms with lubricant, routine testing, fast PEP after exposures, early ART with adherence, and PrEP when your pattern calls for extra armor and steady confidence. Hold this truth close. Knowledge is our strongest vaccine, and silence is the shortcut the virus loves. When you speak, test, and treat on time, risk shrinks, confidence grows, and intimacy becomes safer, calmer, and more connected for both people who share the moment. If one insight changed how you think, comment the number 1 and share this video with a man you respect, because a minute of courage can become the hour that spares someone else months of uncertainty, confusion, and worry he never needed. Tonight's plan is simple. Screenshot your testing schedule, restock condoms and water-based lubricant, set medication reminders, and choose a partner talk this week. Prevention is not fear. It is control, and control is how men build steady lives and protect futures they want. If you are already on treatment, remember undetectable equals untransmittable. Your consistency turns science into protection, so do not stop early. Ask for help with the side effects, and let your care team keep lab numbers boring while your goals grow and your days feel lighter. I'm Dr. James, grateful you stayed. I will see you in Part 2, where I unveil the men's 7-day immunity protocol and share the immune support checklist. So, energy rises, performance steadies, and relationships stay grounded in honesty, safety, compassion, and hope.